As I stand here today, 5 years to the day after I made my first statement as leader of this council, it is the right time to reflect on what we have achieved together so far, and also to understand the challenges that lie ahead of us. What I am most proud of are the important improvements that we, as the County Council, have made to services that our residents rely upon, the ones that make a real difference to their day-to-day lives. We've created 16,000 extra school places over the last 6 years. That's the equivalent of 38 large primary schools. And we have plans for a further 11,000 extra places by 2020. At the same time, working with Surrey teachers, we raise the standards across our schools. 93% of Surrey schools are now rated either outstanding or good. We've helped thousands of older people to carry on living in their own homes. 8,500 in the last year alone. This means that the health service can free up essential resources while also ensuring our residents aren't being trapped unnecessarily in their hospital beds. We've renewed hundreds of miles of the county's roads under Project Horizon, and we are now well underway with the work to resurface our pavements. As our population increases and ages, it is clear that we need to provide essential services for more and more residents, both young and old. The cost of providing adult social care for an extra 5,000 elderly residents annually in need of support amounts to an additional £24 million each year. The funding gap for special education needs services is expected to be £24 million by the end of this decade. And the cost of creating 11,000 extra school places which are required will amount to £30 million. It's important to make sure our health and care services are integrated and sustainable, because at one stage or another, we will all rely on them. That's why I'm pleased to announce, following conversations with the Secretary of State for Health and the head of NHS England, that we are ready to move forward with devolved arrangements for greater integration of health and social care to the Surrey Heartlands Initiative. This will enable health and social care services to genuinely share their expertise, working across traditional boundaries, and make the best use of their resources to deliver services locally. It's a big step towards the long-term sustainability of our health and care services.